There's new hope in the fight against the leading cause of genetic infant mortality. Let's welcome Dr. Crystal Proud, a pediatric neurologist, and joining her is Samantha Lackey, whose daughter Stella was diagnosed with SMA. Thank you so much for being with us.
Thank you for having us.
Dr. Proud, I want to start with you. Talk to me about what exactly SMA is and what are the signs and symptoms?
So SMA is a deficiency of the survival motor neuron protein in the body. It's a DNA-based disease whereby the patient has a missing or mutated SMN1 gene. And as a result of the survival motor neuron protein not being produced sufficiently, the motor nerves over time deteriorate, and unfortunately that leads to progressive weakness in the patient. And most patients are babies, which means that they progressively lose strength over their lifetime, including not being able to do things like roll, sit, crawl, stand, or walk. And without treatment, unfortunately, the majority of our babies will pass away before the age of 2 years old.
Samantha, I'm wondering how your family's life has changed since your daughter Stella's diagnosis.
It's been flipped upside down. At 4 days old, we had seen a pediatrician who told us Stella definitely didn't have spinal muscular atrophy. And in our state, we do not screen for spinal muscular atrophy. You are in a state that screens every single baby for this disease. And 2.5 weeks, 2 weeks later, after that doctor telling us that she did not have it, we were back at our pediatrician, and we saw a different pediatrician that day who had seen Stella in the hospital when she was born, and he right away realized she was not doing things that she was doing at birth. And we were admitted to Phoenix Children's Hospital shortly after that same day, and she was diagnosed at a month old. And when Stella was diagnosed, she had stopped moving totally. Her head wasn't turning from side to side, her arms weren't moving, her legs weren't moving. She was having difficulty breathing and feeding. And we've seen such great improvement since she was treated with the gene therapy, Zolgensma, and
I'm so happy.
I know her future is very bright, and it's
I'm
very
happy to hear
different
that,
than the conversation we would have had.
One of the things that you touched upon is that intervention, that early intervention. Dr. Proud, why is that so important, and how can Stella's story be a story that we hear more about, where the babies are getting better and you're seeing an improvement?
So early intervention and diagnosis is key. It's important to make sure that these babies are being detected with genetic screening and DNA testing, and that they're receiving comprehensive supportive care once they're diagnosed. And that includes 2 options for treatment that are currently FDA approved, one of which Stella received, which is the gene replacement therapy. Of course, it's important for families to talk with their physician about the risks and benefits of these treatments and decide which one is right for them. But the future is bright because we have these new opportunities, and no longer is the story that I used to have to share with families 3 years ago. It's one of hope and optimism and anticipation.
And where can our viewers go for more information?
CureSMA.org is a huge resource for families that have spinal muscular atrophy, as well as the Muscular Dystrophy Association. They've been with our family every step of the way. Avexis and their One Gene program has also been extremely helpful with anything that we need.
Samantha, thank you so much. Thank you for sharing your story and Stella's story. Good luck to you and your family, and thank you, doctor, for sharing this information as well. We'll be right back with more Midday Maryland right after this. Stay tuned.